Really, our own research, and I'll draw on 40 years of scientific evidence at a high level, and we can get into the details if you like, but really it's the basics here that the indoor environment has a massive impact on our health for this simple reason. We are an indoor species. We spend 90% of our time indoors. If we turn that into years, so I'm 44, take your age and multiply it by 0.9, I'll do me. I've spent 40 years of my life indoors. So I've hit the big 4-0 this year in terms of in my indoor life. And research is showing, and our research is showing, that better indoor environments lead to better cognitive function or decision-making performance, our ability to think and operate clearly. Other research has shown links between the indoor environment and infectious disease transmission. Our research shows the same. Better buildings and healthy buildings, fewer sick building symptoms. Certainly none of us knew this would be the pandemic or be this virus at this time, but we all knew in public health it was coming. In fact, I wrote an editorial with a colleague in early December talking about the importance of healthy building strategies during pandemics. So we knew this was a possibility, and we also knew that buildings were going to play a central role in our response.